Welcome to the deep dive. When I first saw the title of this research paper, the one you sent over, I was hooked. ChatGPT acting as a stand-in for real patients during medical school exams. That's wild.
It really is.
We're going to take a deep dive into whether a large language model like ChatGPT can actually be like a standardized patient and, what that means for how we train doctors in the future. And joining us to help us through all of this is our AI and medical training expert. Let's get right to it.
This research is so fascinating. It's where AI and healthcare meet. Imagine AI making really good medical training available to more people, making it more efficient. It's a total game changer.
Totally. But before we go too far, let's break down what standardized patients actually do. Some people listening might not know.
Good point. Standardized patients, or SPs, are people who are trained to act out specific medical scenarios. They embody the patient's history, symptoms, and even their emotions, giving medical students a safe way to practice their clinical skills and how they interact with patients.
It's like acting, but with a real impact on future doctors. The research mentions that this isn't a new idea, though.
It's interesting how some approaches last. The idea of standardized patients was first introduced way back in 1964. But even though they work well, SP programs can be expensive. That's where AI alternatives like ChatGPT get really interesting.
Yeah, that makes sense. So can ChatGPT really do this?
The researchers looked at inflammatory bowel disease, or IBD, for their study. It can be tough to diagnose, and doctors need to ask the right questions to understand what's going on. If ChatGPT can handle this, it could maybe handle lots of different medical situations.
Okay, I'm curious, how did ChatGPT do?
Well, they used ChatGPT-4, the newest version, and they had it do simulated interviews with medical students. The students had to figure out what was wrong with the patient, just like they would with a real SP. And you won't believe this, ChatGPT could tell the difference between good and bad medical questions.
Wow, that's pretty impressive. It's like the AI was understanding the logic behind a medical interview.
Exactly. It wasn't just repeating things. It seemed to get, on some level, what a doctor should be asking to get to the right diagnosis.
I bet it wasn't perfect from the start, though, was it?
You're right, that's where prompt engineering comes in.
Hmm.
It's really important when you're working with large language models. It's basically the art of making very specific instructions to guide the AI's answers and behavior. Think of it like giving a really smart but very literal assistant detailed directions.
Interesting. Tell me more about how they did that with ChatGPT.
Okay, so at first, ChatGPT used a lot of technical medical jargon, not really how a real patient would talk about their symptoms.
Mm.
So the researchers changed the prompts, telling ChatGPT to act like an ordinary person using everyday language.
Yeah, of course. You wouldn't expect someone to walk in saying, I'm experiencing cephalgia, when they just mean they have a headache.
Right. They also added prompts to make ChatGPT's responses more uh, emotionally realistic, like the anxieties a real IBD patient might have.
Okay, they're basically making it more human. I'm guessing this changed the results quite a bit.
It did. At first, there was almost a 30% error rate in how ChatGPT scored the medical students. But then, after they added those prompt adjustments, the error rate dropped to just 6%.
Wow, it's a huge improvement. Sounds like prompt engineering is key to making ChatGPT a better tool for medical education. But did they only do this in English, or did they try other languages?
Now, this is where it gets really interesting. They ran the experiment in both English and Chinese to see if the language made a difference for ChatGPT. And their findings were pretty surprising.
Let me guess, there wasn't a big difference.
You got it. ChatGPT did really well in both languages. It seems like it's not just relying on language patterns. It's almost like the AI understands medical knowledge and reasoning no matter what language is being used.
What? Now that is a deep dive. This research opens up so many doors. And we're just getting started. Stick around for part 2, where we'll get more into the potential of this technology and talk about what it could mean for healthcare in the future.
Welcome back to the deep dive. We just went deep into this ChatGPT research, using it to stand in for standardized patients. I don't know about you, but I'm already seeing how much this could change things.
Yeah, it's really exciting. But it also brings up a bunch of important questions, like ChatGPT showed promise for simulating patient history taking, but, that's just one part of what a doctor needs to know.
That's true. We're not going to have robot doctors replacing humans anytime soon.
Right. But what this research does show is how AI could really improve medical training, especially in places where they don't have a lot of access to those traditional standardized patient programs, like maybe because of cost or location.
It makes me think of rural areas or places with fewer resources. This could really even the playing field when it comes to med school. Absolutely. Imagine a med school that doesn't have a big budget. using something like ChatGPT to give their students good, consistent training.
And it's not just about saving money, right? AI could make the way they evaluate students a lot more consistent and objective.
Exactly. No more human fatigue or biases getting in the way. The AI gives feedback based only on the medical info and how the student is doing, which could be really helpful, especially for students who are just starting out.
Okay, so we've talked about the good stuff. But what about the downsides?
Yeah, we have to think about those too. For example, this study focused on history taking, which is mostly talking. The physical exam, where a doctor actually touches the patient, that's a whole different thing.
So ChatGPT might be great at asking and answering questions, but it can't do the hands-on stuff yet.
Nope, that's something we need more research on. But
Yeah.
there's another interesting thing to think about. Remember how ChatGPT could tell the difference between good and bad medical questions?
Yeah, I thought that was amazing. Like it understood what a good medical question is.
Well, the researchers think we could use that ability to create AI tools that give students feedback while they're practicing.
So while a student is talking to the AI, it's not just acting like a patient, it's also judging how good their questions are.
Right. Imagine a student practicing an interview and getting instant feedback on whether their questions make sense, if they're relevant, if they're actually helping to figure out a diagnosis. Like having a virtual medical coach right there.
That's pretty cool.
Mm.
And it could be used for more than just basic skills. Maybe we could even use AI to personalize how each student learns.
You're talking about personalized learning paths. And yeah, the researchers talked about that too. Imagine an AI system that watches how a student does, figures out their strong and weak points, and then makes a custom learning plan just for them, focus on the things they need the most help with.
It's like a curriculum that changes to fit each student. That's amazing. Are med schools actually using this AI stuff?
It depends. Some are really into it. They see it as a way to improve how they teach and get their students ready for a future where tech is even more important in healthcare.
But I can see why some would be hesitant. It's a big change from how medical education has always been done.
Oh, definitely. There are real concerns about ethics, about bias in AI, and about making sure we keep the human touch in medicine while we're using all this new technology.
It's complicated, and it's important to have these conversations as AI becomes more common in healthcare. But let's change gears a bit. We've talked about how this impacts medical training, but what about healthcare overall? Stick with us for part 3, where we'll look at how these advancements might affect you as a patient. Welcome back to the final part of our deep dive. We've been talking about ChatGPT's potential in medical education, but what about its impact on healthcare overall? How might this tech affect you as a patient?
That's the question, right? I mean, it's early days, but this research makes you think about a future where AI has a bigger part in healthcare, maybe even beyond just training doctors.
Okay, now I'm really interested. Are we talking about AI actually taking care of patients?
Well, think about AI-powered chatbots. They're already getting really advanced. We're not just talking about those simple symptom checkers anymore. This is next-level stuff. Virtual assistants that can answer your questions about your health, give you reliable info, even help you book appointments.
So it's like having a doctor available 24/7.
Exactly. And these chatbots learn every time you use them. They get more personalized, more accurate. It could be a huge help for people who, have trouble getting to a doctor.
I can see how that could help people who don't have easy access to healthcare. What else is coming?
Another area that's really exciting is AI helping with diagnosis. AI systems are getting incredibly good at looking at medical images, like X-rays and MRIs. They can sometimes spot things that even experienced doctors might miss.
That's kind of scary and amazing at the same time. It's great that AI could catch things early, but are we really ready to trust machines with something so important?
Yeah, I get why people would feel that way. But remember, AI in healthcare should be about working together, not replacing doctors. Ideally, AI will offer suggestions, but a human doctor who really knows the patient will make the final call.
That makes sense. So AI as a tool for doctors, going back to those chatbots for a second, do you think they could ever, completely replace human interaction in healthcare?
Honestly, I don't think AI will ever fully replace that personal touch. But it can be a big help, especially for people who might have a hard time getting traditional therapy or counseling.
I'm thinking about people who can't afford it or can't find a therapist, or maybe there's a stigma around getting help. Talking to an AI could be an easier first step.
Exactly. It could be a good option for people who need guidance and support, especially when they can't get to a human professional right away.
Like having a support system right in your pocket, it seems like continuous learning is really important as AI gets better.
Oh, yeah, for sure. And that's what's so cool about it. We could have AI systems that are constantly learning, adding the latest medical research, figuring out what each patient needs and prefers.
So the more we use them, the better they get.
You got it. It's a back and forth with both patients and doctors helping the AI improve.
This has been an amazing deep dive. We've gone from ChatGPT in medical school to how it could change healthcare for everyone. And it's clear that this technology could totally transform how we train doctors and take care of patients.
It's a field that's always changing. What we talked about today is just the beginning.
A huge thank you to our expert for breaking it all down for us. And to all of you listening, thanks for joining us for this deep dive. Make sure to check out the show notes. We'll have links to the research and more info so you can keep exploring. We'll see you next time.